I'm Dr. Shamik Das. I'm a practicing sexologist in Kolkata. In this video, you'll find a lot of useful tips which might be of daily use for you. Coming on to the causes and symptoms of erectile dysfunction. Basically, what is erectile dysfunction? Penis is not a muscle, it's not a bone, it's just like a balloon. I'll tell you how it works. There's a cycle in when a person gets aroused. There's a desire, then there is erection, then there is orgasm, and followed by ejaculation, and followed by deflation or deceleration phase. So the thing what happens is, in erectile dysfunction, mainly the problem is either in the brain. That is, if you're stressed, there is anxiety, and basically, if you don't want to be in bed with your partner, that is one thing. Second is the brain is communicating with the penis through either chemicals, through blood, or through some hormones. If there is something lacking in between, that can cause erectile dysfunction. And as I told you, it's a pump. So there is a valve on both ends. On one end, it pumps in more blood. The other end, it stops the blood from flowing around. And as you all know, the balloon inflates. So that is an erection. So in erectile dysfunction, the problem may be either because of stress or anxiety, or some hormones or some enzymes which are lacking, or maybe there is some circulatory failure. So it's nothing that I have become 45, so I'll have erectile dysfunction, nothing like that. It can happen at any age, from 16 to 86. And it can be because of a variety of reasons. Well, the impact is enormous. Statistics says almost 95% men will have this problem at some point of time in their life. If you break a bone, even an uncle in your neighborhood knows it and you discuss it. But when you have this, you don't know whom to go to. Even you become so much a person who suffering from it will not be able to disclose it to the friends, relatives, or even the spouse or partner. Anyone will feel inadequate. That's quite natural. They don't know whom to go to. They'll try every possible means. And that's what happens every day. And we find thousands and thousands of people all around who are suffering from it. Well, will you mean that 95% of all males are suffering from this at this point of time? No. It might be temporary, it might be a permanent thing, but there's a cure to it. First of all, we have to find out where the problem lies, whether it lies in the brain or the chemical system or in the pumping mechanism. Some people blame the diabetes as a cause. Diabetes is a contributory factor, but that cannot be the only contributory factor towards it. Because you see, it's not only circulation. If there is no desire, if the chemicals are lacking, your circulatory system might be absolutely perfect, but it will not work, right? At the same time, there are a lot of people who think that eating some particular vegetable or a fruit or a nut will increase the erectile issues, but that might increase the libido. You might change the ambience, you might change the partner, you might do a lot of things. Some people complain that I am getting erection with my wife, but I'm not getting it with my partner outside. That might be a guilt conflict. Some people complain otherwise. I'm getting a erection with my partner, but I'm not getting with my wife. Well, then the problem lies it's an interpersonal problem. It's your brain, the CPU is not giving a signal that, well, I want to be with this partner, right? In that case, you will not get a single erection. even if you sleep for nights together. People connect genetics with erectile dysfunction. Well, that's a myth. It can't be. It can't be that generation after generation people are having erectile dysfunction. That's not possible. Then your procreation wouldn't have occurred. There are a lot of studies on linking alcohol and smoking. Well, alcohol, what it does is, I told you about these enzymes. These enzymes get manufactured and processed in the liver. So if you take a lot of alcohol, your desire will increase, but the enzymes are not getting processed. So it's coming late. The raw materials are coming late to the factory. So the things doesn't get produced. So you won't have a erection because of lack of raw materials. That's what happens in case of alcohol. So the liver is getting damaged because of that. Because of the damaged liver, the lack of enzymes, the trouble starts. I have found a lot of people with hormonal imbalance, say pituitary microadenoma, thyroid issues, for which even the brain is sending signals, but it's not getting passed on to the penis. So in that case, you won't have an erection. Coming to smoking, well, a lot of smoking, it causes atherosclerosis, a condition in which the blood vessels get clogged, the circulation is hampered, so you won't have an erection. First of all, we have to pinpoint where the problem lies, and then we can sort it out accordingly. There is no one size fits all kind of thing that you take XYZ medicine which is prescribed in the market, which is readily available, or you give a massage and you get an erection. That's not possible. It has to be, if it is a problem for a long duration, it has to be sorted out. The problem has to be found out and it has to be sorted out. Things can be taken care of. If you have a head, you will have a headache. So at some point of time, if your headache persists, you have to take a medicine and get cured of it. That's it. I hope these videos were of much use for all of you. You'll find a lot of these helpful tips. You can find me on careclues.com.